Ladies and gents, welcome to the John Harris Podcast. Let us know where you're listening from using the hashtag The John Harris Podcast or follow me on Instagram at The Original John Harris. Today's guest is a special one. She's a medical professional, no less, a doctor of obstetrics and gynaecology. In short, an actual genius on the podcast. It is my pleasure to welcome Dr. Sarah Murphy.
Hi, John. Thanks so much for having me on.
Thank you for joining. Absolute pleasure. You are the first medical professional to have joined the John Harris Podcast. Must be an honour.
Honoured.
Yeah. As we discussed very briefly, the first feature, which we always dive into straight away, is the quickie picky feature. I've got 8 questions today. The last one I asked everybody, but if you're happy, we'll just go straight into that.
Okay, let's go first.
Lovely. So question 1, what song would you sing at a karaoke bar?
Simply the Best.
Tina?
Yeah.
Very good. What's the best Christmas present you've ever received?
A trip to Paris.
And what's the worst Christmas present you've ever received?
Oh, that's a mean one. I've been quite lucky with my Christmas presents. Probably like a piece of clothing that I didn't like.
Who from?
My parents.
Yeah, I got a toilet seat one year. That was pretty
Oh
bad.
God, that's actually bad.
Yeah. Which is your favourite animal at the zoo?
Oh, elephants.
Which 3 items would you take? Well, I've actually written desert island, but I meant desert island.
Sun cream, water, and my phone.
Yeah, that's probably sensible.
The basics, yeah.
Yeah. Are you related to anyone remotely famous?
No, nobody.
Leading on from that, weird if it was the same answer. Who is your celebrity crush?
Ryan Reynolds?
With a big question mark at the end of it.
No, I think we'll go with him.
And last one, you'll be glad to know. If you were ever running for office, what would your campaign slogan be?
Oh my God, that's a hard one. I don't even know.
Everyone has to give an answer.
Something like a woman for the women or something. I don't know.
A woman for the women. That's fine. That's good. It's not the worst.
Just as well I'm not running.
So that's that useless feature out of the way. I know we've caught up a little bit on Instagram or whatever, but again, thank you for joining. You are, like I said, your first medical professional to join. Before we get into the nitty gritty of your specialisms and things like that, what made you choose medicine? Tell us a little bit about that journey, how you got to where you are, and then we'll dive into a bit more about your career now.
Yeah, so I think some people have like really profound reasons or really inspiring stories of you know, they were sick or a loved one was sick and all of that. Mine is quite a boring thing. At the end of school, I was trying to think about what I wanted to do, and I really liked science, and I worked. So that was it. It was really simple. Yeah.
Sorry, I lost a second. I got the gist of it. My microphone cut out ever so briefly, but so there's no profound reason. And I mean, I'd imagine if you were like science and you decided to get into medicine, you were quite clever.
I suppose I was, yeah. You have to be modest about it.
No, you don't. You're a genius. And obviously, medical school is years of training.
Yeah.
You're now qualified doctor for how many years?
This is my 5th year.
Okay, and you've started to specialize, I believe, in obstetrics and gynaecology. What made you choose that?
A couple of reasons. So when you're in medical school, you get taught all the different specialties, and when we were being taught obstetrics and gynae, the consultants were so passionate about their specialty and so passionate about advocating for their women, and I just thought, oh wow, that's really lovely to see. And it's a really interesting specialty, so you get to do a lot of different things and every day is different. So you go from, you know, being in the operating theater to helping deliver a baby on the labor ward to, you know,
Mhm.
seeing an elderly woman in a gynae clinic. So it's really versatile.
Uh-huh.
And then it's just really nice specialty. Like, you know, you get to help women and empower women, and you get to see lovely babies being born. So it's really gorgeous.
Adorable. And I noticed from your Instagram that, well, not even that long ago, if you scroll down a little bit, a lot of it was sort of general health and well-being, and then more recently it's turned to, say, not specifically just gynae, but female and things like breastfeeding and stuff. Is that a conscious change you've made in terms of a social media standpoint, or go on?
Yeah, so it's really observant of you. I suppose I see when I originally started doing Instagram, and it's like 8 years ago, it was just like a health and fitness one. And then I suppose a bit of me feels sometimes a bit hypocritical because, you know, I come home from a night shift and I get a pizza and lie in bed and watch Netflix, and, you know, I'm not exactly myself, the beacon of health. So I moved away a little bit from that to avoid being a hypocrite. And also I thought, well, what actually am I doing? You know, who am I helping, or what am I offering by sharing I went for a run? And I understand, like, some people are PTs and health coaches, and that is what they do, but that wasn't what I was doing. It was almost like I was just, you know, I didn't think I was offering anything. So I had a little think about it, and I was like, well, if you're going to be doing something on social media, what do you want to gain from it? And I thought, well, I would like to, you know, get involved in a bit more health promotion. So I've tried to change away from it a bit. And still, I suppose, you know, share if I'm keeping active and things, to give more insight into what I myself are up to.
And so, like I said, recently there's been obviously a lot of stuff you've said, which is really interesting, about vaccines. With regards to, I mean, the three things I've seen more than anything of are breastfeeding, fertility, and pregnancy. Now, it's the minefield at the moment is the vaccine, and keyboard warriors and people having completely unresearched opinions, or sometimes researched opinions, or whatever. But it's the Marmite topic at the moment. How has that affected? I mean, tell me about it. Because I mean, I've had both vaccines. My wife's had both her vaccines. I have absolute trust in it. Yeah, I felt rubbish for 3 days, but, you know, I'd rather feel rubbish for 3 days than be hospitalized with COVID. Talk about that, because it's obviously a subject you're passionate about, but I can imagine it's a complete minefield for you being a medical professional.
Yeah, or it's, you know, it's a really, like, quickly evolving. Well, I suppose the basics are the same, but, you know, every week there's new papers coming out with, you know, different studies and more data, and you're trying to keep on top of that, because I suppose if you're going to be talking about it in a public space, you need to know your stuff. So that's work. But I'd want to be doing that for my job anyway, so that doubles over. I think, you see, maybe if you want to just keep it simple, there's three groups of people. So there's the people that are like, yep, I'll get the vaccine, cool. There's the total anti-vaxxers who, you know, I can't see eye to eye with them. And I, you know, you try and always, you know, try and see things from other people's point of view, and I just can't. But then there's a group in the middle, and they're not anti-vaxxers. They're what I kind of call vaccine hesitant, and it's people who are just genuinely scared or worried, and are being bombarded with different sources of info and don't know who to trust or what to go by. And I think they're the people that, you know, need firstly factual, you know, scientifically based info, but they need info that's simple to understand. And that doesn't mean that they're simple, but it just means, you know, a lot of the stuff's coming out, it's quite hard to understand, and you need to really, like, break it down. So I think that they're the group that I'm trying to maybe get across the message to. So that was my kind of aim behind talking about the vaccine war, is to provide factual information that's easy to understand.
And what sort of questions are they asking you?
Well, the biggest one see, I've a lot of pregnant women or, you know, postpartum women follow me. But so the biggest one in general is, you know, how do I know that this won't affect my baby long term? Or which people are just genuinely worried. They're like, well, how do you know that in 10 years' time I'm not going to have something wrong with me because I took the vaccine? I think people are just genuinely scared about what will happen in the future. So that's kind of the biggest one.
Right. And how do you allay those fears, really? Because I'm in the first group. I'm here's the letter. You offered a vaccine. Okay, I'll get it. Because it's more than anything in my mind, morally the right thing to do. I felt I had COVID last January. And it was pretty miserable, but I was never close to being hospitalized or anything.
Yeah.
And I did a little bit of reading, but in the great context of things, next to nothing compared to what some people have done. And you got your letter, right? You're eligible for your vaccine. Well, then yes, because I'm a 32-year-old healthy male that does a lot of running, and I've got a fairly reasonable chance of it not having any effect on me, and a little bit of effect, but whatever. So I was in that group of yes, just do it, and because morally it felt. I find if somebody asks you a question, often they're going to be sometimes unconvincible. Have you found that? How's that been trying to convince them? Because there's a lot of people will come to you on social media, in your job, through email, whatever, and you've got to go through that same thing every single time. Has it been generally successful? Have most people been converted to taking it? How's that been?
I think generally quite successful. So then I wonder, am I working in a bit of an echo chamber? Because I haven't gotten much, you know, aggressive messages or, you know, really, you know, keyboard warriors. I haven't seen much of that. You know, there's the odd one, but, you know, it's kind of people ask the same questions again and again. So it can get a little bit tiring, because you know, there's a lot to it, because you need to be empathetic to how they're feeling, and then you need to kind of, you don't want to bombard anyone with info, so you're trying to, you know, dance around that, and then you're trying to give info in the right context in a way that people understand. So it can get a little bit tiring. And I think this week even I was like, I think I might step back from these posts for a week or two, just because it's a little bit mentally tiring.
But the thing is, for you, it's everybody coming to you, but for the people coming to you, it's
just them.
Yeah, there's a real reasonable chance that you're the only person they're asking. So for them, it's everything, and for you, it's everyone.
I know, yeah.
And there's only so much the filter can take. That's interesting. What about? So, are there any risks then, or is there anything in terms of the breastfeeding, the pregnancy, the fertility? Are there any side effects that you've seen, or anything that, like, specifically that people should be worried about?
No, so I suppose the risks for all of those are the risks that exist for everyone. So you have all those common ones, and it sounds like you had them, and I had it as well after the second dose, where I actually felt crap, like real flu-like headache. I had like a low-grade temperature, nauseated, weak, tired, and that can go on, you know, for, you know, a day or so. With the AstraZeneca and Johnson & Johnson, there's very rarely you can get blood clots with it, but in the context that COVID is more likely to give you clots than the vaccines, and with the mRNA vaccines, there's really rarely people are getting inflammation of their heart, or you might have heard of myocarditis. But again, the chance of you having a heart problem with COVID is higher than you getting this with the vaccine. And so they're kind of the big ones that we're seeing. I suppose in pregnancy, people are always nervous about getting a temperature, but the temperature with the COVID vaccine seems to respond. Well, one, it seems to be low grade. Two, it seems to be really short, and three, it responds really well to paracetamol. So really, no, there's not a lot to worry about other than those things.
Yeah, I mean, you said that you might have heard of myocarditis. It won't surprise you to know that I haven't heard of myocarditis. What is that, just for listeners?
So the myocardium is the muscle of your heart. And so anything where you have itis at the end just means inflammation. So it's actually the muscle of the heart is getting inflamed. Right.
Okay. And to go back onto the blood clots thing, because this isn't, and this is where we shall come on to anti-vaxxers. Often keyboard warrior type people will see a headline, never read the article, and then pass opinion on the 10 words they've seen at the top of an article, as in AstraZeneca vaccine causes blood clot in 27-year-old patient who dies.
Mm-hmm.
And then they'll go to town on it. If they read it, and forgive me if I'm wrong, but more often than not, they will have had some underlying health issues, or some health issues underlying that they didn't know about, or there will have been some sort of reason, or they might not have had a healthy lifestyle, or whatever. Now, there's absolutely, those people don't deserve to be ill or anything, of course. But how do you deal with the fact that often the anti-vaxxers are sometimes the least researched of the people, because those middle section of the people who are just worried about it actually is absolutely fine, because they're asking genuine questions and basing their response on detail from professionals like yourself. How do you feel, and how do you deal with those people that it's a blanket no, regardless of, if you say something's black and they say it's white, they believe it's white regardless? How do you feel about that?
I've gotten to the stage where I don't know if it's worth engaging, because right. And I don't know if that sounds awful, but as it is tiring to explain things, and if the response or the outcome isn't going to change, then I don't know if it's worth it. I think there's certain people who will never get on board with the vaccine, and and that's that. You
can't educate stupid.
It's not mine.
And what do you think about sort of, obviously, as the world gets back to normal now, and there's still, I think yesterday was, at the time of recording, maybe 38,000 cases in mainland UK. My opinion is that at some point we had to go for it, because by definition, COVID will never not exist, I don't think. At some stage we had to open things up because, herd immunity and all, there's a million reasons, economy, etc., etc. What about people who are anti-vaxxers who want to go to, say, football matches or nightclubs, who are going to enforce vaccine passports? Do you think they deserve to get in somewhere, or do you think it should be vaccine passport or no entry?
I think vaccine passport or no entry, and I don't know what the response now to that will be, but people say, oh, I have rights and I have the right to my autonomy and my own medical decisions. But when it comes to things like vaccines, so there's certain health decisions you make that affect yourself. And then there's certain decisions we make as a society that affect the society. So when we talk about vaccines, we're talking about public health. We're talking about everyone. And I think you do have a moral responsibility to make the choice that best supports your society. This is a really silly analogy, but drink driving. And someone might argue, well, if I want to drink and drive, that's fine. But the fact is that you might run into someone else on the road and affect them. So it's fine if you want to kill or injure yourself, but it's not fine if your decisions impact someone else's life. And I think vaccines are the same. What we have to do is consider society as a whole, and we have to make the best decision for all of us.
Absolutely. And I think, with the potency of COVID, especially in the, with certain variants, and at the start, you could have given it to somebody who gave it to somebody else, who gave it to another person who then died. And I know that's immeasurable, because you can never know exactly where you got it from. But I think I agree with you on the moral, the moral responsibility aspect, because anybody with any sort of moral compass would question themselves, or should question themselves, might I say, if you've got it. I mean, you've seen these things from music festivals a couple of weekends ago, people finding positive lateral flow tests at music festivals.
Oh my God, I haven't seen that.
Oh no. So Leeds and Reading, I believe, and there's, obviously the little rectangular plastic thing, and there's the two lines on, and there's loads of them being found, hundreds. And there's that. And I know the lateral flow tests are questionable in their accuracies. But if you get a positive one, surely you then don't go anywhere, have a PCR test, and then make a decision based on that. and there was hundreds of these things found. And the problem with things like that is that then people start stereotyping. Oh, it's a load of teeny boppers at these music festivals. Oh, they don't respect and all of this. But it's true. If you had a positive lateral flow test, you wouldn't be allowed into work until you had a PCR or whatever. I can't imagine, as would anybody really in any walk of life, because the virus doesn't discriminate based on location or age of who gets it. It's a total minefield. Like I said, sometimes you can't educate stupid, and I think that the unconvincible will remain. So the problem will be is when they kick off even more. I say they generalize, kick off even more when things like vaccine passports come in.
Yeah, it's Ireland is doing something interesting. So from the 22nd of October, we're basically going to, almost no restrictions. The only thing that's sort of staying in, we'll say, is, masks on public transport and masks in healthcare facilities, which I think sounds reasonable. But they're currently, to get into a restaurant or a bar, you have to show your vaccine passport, and they're removing that from the 22nd of October.
Good. In my mind, going to go for it at some point. Well, it will be interesting, because I wonder when, again, I don't want to stereotype, but I'm going to, some of these families, when they can't have their, annual holiday to Benidorm because they don't want the vaccine, what it will take for someone to get the vaccine, if you know what I mean. We can move on from COVID, because it's not all consuming, and the C word is often overbranded, because I want to get a bit more into the fertility and female health side of your job. My wife had operated on recently, endometriosis, and that's obviously something you'll be aware of course. But the fertility aspect specifically, I just want to understand a bit more about your position in that, and what that means to you. And feel free to talk technical, because there'll be some people listening, and like I said, if there's words like myocarditis, whatever it was, I will ask you what they mean. But just talk a bit more about that, and we talked already about how you sort of decided to specialize, but just a bit more about your journey with the female health side of things.
Yeah, so and if you want to talk about endometriosis, so that's something we'll see in our clinics. We see kind of women will come with it for different reasons. So some women will have horrendously painful periods, like debilitating pain. Some women will have really heavy periods, and then some women might have problems with fertility, because endometriosis can lower your chance of having a baby. So that's how we will see them. The problem with endometriosis is it's, for so long, I don't know if we were great at diagnosing it, and it is a difficult diagnosis, but lots of women were kind of left to suffer for quite some time. You need to have a definitive diagnosis. So to be told with certainty, this is endometriosis, you need a surgery. Once you start having surgeries, I suppose, there's a bit of a cycle there, and obviously surgeries have risks. But it's a really tough one for women, and especially if a woman's young and hasn't really thought about her fertility, and now is being told this is something you're going to have to start thinking about. And if kids are something that you wanted, you might need to get a move on, as to speak. So it's
crazy. I mean, I've personally, between the two of us, we've learned so much about it. What was one of the craziest things for me was that you are actually born with your egg. Is this right? Am I getting this right? You are born with the amount of eggs in your body that you don't make anymore. You are just born with what you're born with.
Yeah.
And if you have, I know it's millions, but if you have problems getting those eggs, or the quality of those eggs, there's no way to make new ones.
Yeah.
Which is insane, that at 0 days old, you are essentially, there are paths that are already written for you.
Yeah.
And that's absolutely insane. Another point I want to talk about, and how you feel, is that, I mean, endometriosis specifically has been in the press a lot more recently. Certain celebrities have talked about it, which is always healthy for something. I mean, it's obviously in my mind a lot more because we talk about it at home and research it. So it feels like it's a lot more prevalent in society. But what about the sort of the perceived taboo with because it's bullshit. It's not. It shouldn't be a taboo with things like periods and fertility issues and gynecology issues that people have. Do you think part of the problem is that people don't come because they're ashamed or afraid? And it shouldn't be that case, but like I said, it's perceived taboo. Is that something you've experienced?
Yeah, I suspect maybe it's two things. So one is, the embarrassment or shame. And we definitely see this more with older women.
Right.
So, it might be women in their 70s and they've been having some bleeding, and obviously shouldn't be because they've gone through the menopause. And you'd be like, how long did you have this for? And 3 years. And then you're like, well, why didn't you come? And they're like,
yeah.
Oh, I didn't want my doctor, my GP is a male, and I didn't want him to be looking, and I thought it was fine. And then I think the second thing is, I think because with things like endometriosis, there's definitely women who feel like they've been dismissed or fobbed off. I think sometimes people they don't have a lot of faith in the system, or they don't know how well they're going to be treated. So actually the alternative of doing nothing might feel better to them. And I think it is true for sometimes female health problems that sometimes women don't feel listened to, and leave things go. So
and is that something to do with why you're so passionate about sort of female empowerment and helping women? Is that, do you think, one of the reasons that you're so sort of on it with that?
Yeah, I think so. I think, for I don't know how long we've been, the gender who's a bit more suppressed, and that makes no sense to me. So I don't know why that should ever be the case. It's something that I think would be wonderful to change.
I think people are getting better at talking about it, and so they should. But it's obviously got a long way to go, and that's across every single, a hugely broad range of subjects. That's from the suppression of women to endometriosis specifically, or whatever. That people are getting generally better at talking about things that they previously haven't talked about. But it's still difficult, I think. And I think with intimate health problems, you obviously need to get them sorted, but there is that embarrassment. A lot of people will know their doctor, or might be an associated family friend, or doesn't want to go to the GP because sometimes there's distrust in GPs. Oh, they're just jack of all trades, and all this, and all of these stereotyped opinions that more often than not aren't true, because the fear is often worse than the reality in 95% of situations. But people need, the only way to get stuff sorted is to talk to it. And I think what you said about some people having lack of faith in the system is probably something to do with a patient pathway that might historically have been a bit convoluted, and you've got to go through this stage to get to that stage, whereas people just want to get it sorted. But also there isn't the bandwidth for everybody to go and see the absolute correct leading professional straight away, is there? You said something, talked about menopause. Now, we've seen countless comedians 20 years ago make jokes about it and everything. Actually, I don't really know what the menopause is. So tell me.
So I think the definition is when it's a point in a woman's life when she's no longer able to bear a child.
Right.
But basically it's the cessation of your fertility, your menstrual cycle. So your ovaries stop producing a type of estrogen that kind of makes lots of things happen. So that's the basis of it, is that's going to be that your ovaries stop doing that and you stop getting your periods. But then it comes actually with loads of other things. So women will be more tired, get hot sweats, night sweats. They are less likely to want to have or enjoy sexual intercourse. They're more likely to get urinary tract infections. They're more likely to have depression. There's a lot of knock-on effects. So it's not just your periods and now stopped. There's a lot to it.
And does it end?
I suppose once you reach menopause, and then you're menopausal. So you're menopausal then for the rest of your life. But these symptoms usually are short-lived. So you would
Right.
hope that, if you're having trouble sleeping or if you've low mood, that might last for 1 to 3 years and then
Right.
that passes, but you are still menopausal.
Okay. As with anything, the longer you have something, the better you become at dealing with and managing and whatever. Yeah.
Your body, I suppose, adjusts.
That's really interesting. It's interesting. I've never actually heard it described. People just say, like I said, comedians did 20 years ago, you can watch clips back of whoever saying, menopausal or whatever. And I've never actually heard a succinct description of what it is, which is very naive of me. And as we've talked, it's things that we should be talking about. Yeah. So medicine aside, we've covered a bit of your specialities now, obstetrics and gynecology. What's the other side of Dr. Sarah Murphy? Or is medicine everything?
No, it's not everything. But the other side, I don't think it's overly exciting or interesting. I think it's just what I think is normal. Like, I like going for dinner. I like going for drinks. I like when COVID is not hanging over us. I like traveling. Just what I think are kind of the normal basic things that maybe everyone enjoys.
And to go immediately back to medicine, excuse me, obviously people in your industry have worked obscenely hard over the last 2 years, but also you work obscenely hard anyway because there's no shortage of patients. It's one of the industries that never has a lack of supply and demand is never an issue, for want of a better phrase. How have you found the shift work? Say you work nights and stuff with COVID, but with also managing this, because I'd imagine you've done a lot more tele consultations and non-face-to-face or whatever. How has that affected your practices?
See, I think really, I don't need to know if you see them, but I see doctors on social media kind of talking about, I just saw another person in ICU pass away with their family at home, and we've had to refuse someone in ICU, but I haven't had to deal with that. So
right,
I haven't seen the direct effects of COVID. So I've been quite lucky in that perspective. Like, I haven't seen someone die from COVID.
Okay.
I suppose in our specialty, we're seeing the byproducts of it. So we're seeing, a woman's surgery that she's been waiting for a year be cancelled because we're not doing it in COVID, or we've seen a woman, miscarry and her husband is at home, or a woman in early labor and her partner isn't allowed in. So I've seen the byproducts of it, which are tough, but I do acknowledge that I think I haven't had it as hard as a lot of my colleagues. It's
still rough though, and the fertility and the birth side of things, when men were literally waiting at the door and not allowed it. I mean, there were times, I believe I've seen stories where they weren't allowed in at all. And
I think our hospitals did let them in for the birth, but like when a woman's having a baby for the first time, her pains can go on for, you're talking plus 12 hours. So for a lot of that time, she was alone, and that's
it's really sad. Yeah. Would they be like sort of in and then back out as soon as baby's born and they've had a cuddle, or?
It was hospital dependent, but usually 2 hours. Yeah.
Oh, it's just brutal.
Yeah. It is, because it's the man's baby too. So it's hard for him as well. And then, after a woman has a baby, she needs, support and help. And obviously getting that help from your chosen person is the nicest person to get it from.
And it is tough because it's unprecedented, most overused words of the last 2 years, but it is unprecedented. And I feel somewhat for the hospitals and for the management and the councils that have had to make these decisions, because they've never had to make them before for this, because we've never seen anything quite like this. So there's, regardless of what decision they make, if they made the decision that they did make and not letting people in, there'll be a load of people annoyed by that. If they said, right, full access to everybody, there'd be a load of people nervous about COVID, annoyed, and you're never going to please everybody in this world. One of the few things that came from the first lockdown, actually, few good things, that came from the first lockdown, was that everybody seemed to be a bit more together and a bit more appreciative of each other and good things in life. The problem being, as we stepped out and then back into lockdowns and everything, it became very clear that people's patience was wearing thin. But we are where we are. So as long as generally you're a nice person, you work hard and you do good things, then I think you should be all right in general. I want to get onto the legend and loser feature of the week. Do you want to go first or second? Second. Okay. My legend of the week is a guy called Mark Rober. I don't know if you've heard of him. He's a YouTuber. I wrote it down because I didn't want to forget, but he spent an entire year building a 5-ton slime volcano as a surprise for a young cancer patient. He barely knew him. He just heard his story and loved it and wanted to do something because the kid loved like slime and explosions and things. He spent an entire year building a 5-ton slime volcano, which I just think is so bonkers and so brilliant and wonderful. So that's Mark Rober, YouTuber. And the loser is Channel 4. They have scrapped plans for a celebrity episode of Naked Attraction. I don't know if you have that over in Ireland. Yeah, you do. And they've scrapped plans for a celebrity, which I think is something we'd all have loved to see. Apparently, there wasn't enough celebrities willing to go on it. And I just thought, the likes of Keith Chegwin, who historically been naked on television, they should have got in touch with them. But I'm absolutely devastated that Channel 4 have scrapped plans for a celebrity naked attraction. So Channel 4 are my loser of the week. Would you like to reveal yours?
Yeah, my legend is going to be a little bit of a sad one. With Sarah Harding, who unfortunately passed away from breast cancer this week. And I think before her death did a lot to campaign because I suppose she's young. And even now in her passing, very like Jade Goody, and unfortunately it's sad that someone has to pass to raise so much awareness. But, I think her passing and her talking out about breast cancer in youth is raising a lot of awareness. And then my loser of the week is some of our government officials who, I don't know if you'll see it at all in the UK, they're every day now in the news, there's texts from them being released and emerging lies about who knew what of a government position and who went to a party when they weren't allowed, and I'm just sick of it. So they're all my losers of the week.
Fair enough, all of them.
All of them.
What is I'm getting this right, what's the name of is it the president? Who's the little guy? It looks like
the president.
It looks like a cartoon character. What is it? Is it Sayok or something? Is that right?
No, so he's a president, and then we have a Taoiseach.
And what's the Taoiseach?
It's our prime minister.
Right, but the president's the little guy who goes to like the rugby and walks along and says hello to all the rugby teams in front of all.
Yeah.
Right, that's him. Okay. Yeah. But he's the president, so he
good.
wouldn't.
He's great.
He's great. So he's not part of your Loserville group of the week.
No.
And there is one other mini feature before we wrap it up called the Refer a Friend feature, where I ask guests such as yourself if they'd like to refer a friend from any walk of life, if you think they'd be interesting and interested in coming on the John Harris podcast. If they come on and become a guest, then I will donate some money to a charity of your choice. I don't tell people at the end because I want them to think quickly, because often the quickest thoughts are your best ones. So do you have a friend? They can be from any walk of life, anywhere, who would be interested in coming on this nonsensical podcast of mine?
Possibly. There's the first one who comes to my mind, there's a girl in Ireland, she's a personal trainer called Natalie Lennon. And she's really lovely and excellent, but this week she is talking about how from overtraining and under eating she lost her period. And I think one, that's really brave to talk about, but two, I think it's really important because I think with a lot of women getting more into exercising and things, a lot of women are going to lose their periods, and she's raising a lot of awareness about it. But she's gorgeous and bubbly and lovely, so she'd be nice. Great
recommendation. Well, if you could kindly send her a message, tell her who I am, tell her you've done this, and hopefully if you've had a good time, tell her you had a good time. And I'll send her my details on Instagram or whatever, and send me a message, and I'll get her booked in.
Perfect. That's a great idea.
I do want to say thank you so much. Some really interesting topics covered. It like I said, quite interesting as a man to be learning certain things which we should all know, and it's great to have more awareness. So I'll let you know when it goes out. It'll be a couple of weeks. And thank you for your time. That was Dr. Sarah Murphy on the John Harris podcast.
Thanks so much, Sean.